Dr. Gabriel is from the Uni of New South Wales, and he's going to present some of the work he's been doing around travel distance and radiotherapy utilisation.
Good morning, everyone. This is a part of my PhD study, which was on factors affecting radiotherapy utilization in New South Wales and the ACT. This is the Cancer Institute. The aims of the study was to calculate actual radiotherapy utilization in New South Wales and the ACT and identify factors affecting radiotherapy utilization and quantify the effect of geographic variations on radiotherapy utilization. Study cohort, the denominator was all New South Wales and ACT patients diagnosed with cancer during the study period 2004 to 2006, and the numerator was all patients from the denominator who received radiotherapy, at least one course of radiotherapy. What's new in this study? This is the first time ever to have three things done in the same study, which were collect patient treatment data from all radiotherapy departments in New South Wales and ACT and match each radiotherapy record with the records in Central Cancer Registry in the two states and use a GIS or Geographic Information System software to geocode all street addresses of patient residence and radiotherapy department and calculate the road distance between patient residence and the nearest radiotherapy department and determine the magnitude of cross-border treatment. The method: collect and organize data from all radiotherapy departments, link the radiotherapy data with Central Cancer Registry data through Cheryl, geocode patient addresses and radiotherapy department street addresses, calculate the road distance between patient residential address and the nearest radiotherapy department, and analyze the data to identify factors affecting radiotherapy utilization. This is like a flow chart of radiotherapy and Central Cancer Registry data linkage. And if we see here, we have 17, at that time we had 17 radiotherapy department in New South Wales and ACT, and each one of them, they have, we collected patient identifiable data plus demographic data plus treatment data, which means radiotherapy data. In addition, at that time, we had Central Cancer Registry data set, which had, again, patient identifiable data, demographic data, and tumor data. And through Cheryl created a key for each person in our radiotherapy data here, and that key is called a patient project number, and they assigned the same number to the CCR database here, and that's why we managed to merge both data sets here, and we got final data set which has the patient project number instead of patient identifiable data plus demographic data plus treatment data from radiotherapy department and tumor data from Central Cancer Registry data. We had 16 radiotherapy data centers in New South Wales and one in the ACT and two Central Cancer Registry in New South Wales and ACT. And as expected, radiotherapy and Central Cancer Registry data were inconsistently recorded among departments and registries. How do we measure or calculate the distance between patient residence and healthcare facility? To geocode means to use a software program to convert street address into coordinates, which are like longitude and latitude. And GIS is Geographic Information System that manages and presents data that are linked to one or more location. GIS software is used to calculate route distance between two or more locations. Example of coordinates, if, for example, street address here, 1 Campbell Street, Liverpool, this is the address of the Ingham Institute, we can just feed it to the program and we can get different scenarios here, I mean. If it is decimal degree, we will get it this way here. If it is degrees and decimal minutes, easy if you 0.91 whatever here, if you multiply it by 60, which is like 60 minutes in the degree, we will get 55 degrees minutes 0.11 and so on. And again, we can get degrees, minutes, and decimal seconds the same. Here, we didn't have a minus or plus here, but we have south and we have east, which determines the location in the world map. What we did here, we had like a map of New South Wales and the ACT, and then I added all patients diagnosed with cancer to this map. And each diamond here represents one patient. And this based on the location of residential address of each patient. And the blue circle, the yellow circles here indicates the location of radiotherapy centers. And as you know here, most of radiotherapy centers here are located in Sydney, one in Newcastle, and one in Wagga Wagga, and this is the ACT one in Canberra. Then I added those who were given radiotherapy during the same period, and in the green here, in the green diamond. And from this one here, we realized that there are at least 3 areas where we have more red diamonds than the green diamonds here. This area and this area here and that area here. Which means that patients were not given radiotherapy in this area as expected, or at least we don't have records of receiving radiotherapy for patients living in these areas. These 3 areas. We know that patient next to the border, they cross the border and they go and receive radiotherapy outside the border. But because we don't have records of those who were treated outside New South Wales, so after collecting the, after collecting the data here, we found that more than 10,000 patients were in these 3 areas here, and we expect that these patients got radiotherapy outside New South Wales because we didn't have records except for 523 patients recorded in New South Wales as receiving radiotherapy, which gives almost a radiotherapy utilization rate of 5.2%, which is too low. If we include these patients into the radiotherapy utilization here, we underestimate the actual utilization because we don't have records of those who are at the border of New South Wales with Queensland, Victoria, and South Australia. Here, this is the calculation of road distance here. And each line here indicates the shortest distance between patient residence and the nearest radiotherapy department. And these were the 3 radiotherapy centers outside the New South Wales. And again, this is the data I just mentioned here, almost 10,000 patients, and out of these, 523 received or recorded as receiving radiotherapy in New South Wales. Our data indicated that, or our study indicated that the actual radiotherapy utilization in New South Wales and ACT during that period was 26%, and compared to South Australia, it was 25%. USA during the same time from Sears data, it was 23%. Canada in 2003-4 was 33%, but in Europe it was higher. In Sweden, 37 to 46%, and in Italy it was 41%. So does travel distance affect radiotherapy utilization? From our study, we found yes. The answer is yes. The more you travel here, the less likely to receive radiotherapy. And this is like a significant trend of receiving radiotherapy if you were, living next to, or nearer to radiotherapy department. Age and distance, in this one here, in each age group, we found the more the patient travels to radiotherapy department, the less likely to receive radiotherapy. And this is consistent across all age groups. Tumor stage, the same in tumor stage here. In each one, the more you travel to the radiotherapy department, the less likely to receive radiotherapy. Social economic status. Here we found in this one, the total here is more or less the same. All the socioeconomic levels here, from 1 to 3 or 4, is higher than the most advantaged socioeconomic status here, But within each one of them here, within each one of them, we found that the more the patient travels, the less likely to receive radiotherapy. The less likely to receive, except this one, which has here explanation here. This here, 50 out of 21,000 plus. This is the same one here. Patient survival, we found that, yes, the more you travel, the less or the decreased survival patient had, and the less you travel, the more or the increased survival patient had. Univariate logistic regression here, we didn't find any significance among years of diagnosis. Patient groups, yes, we found it was significant difference between those who were given radiotherapy and those who did not get radiotherapy. Age, and if it is continuous, again, yes. And we found that for each 1 year increase in patient age, there was 1.7% less likely to receive radiotherapy. For tumor stage, regional and distant were more likely to receive radiotherapy. Gender here, we found that female were 30% more likely to receive radiotherapy than male, and we had explanation for that. And primary site of cancer will be explained in the next slide. Travel distance, the same. We had a 10% decrease in radiotherapy utilization if the patient travels 100 kilometers to reach the radiotherapy department. Accessibility, remoteness, the same. The more remote, the less likely. And socioeconomic advantage, there was no association. This is the multivariate analysis here, and it is the same except one thing here, which is the gender here. Previous one indicates that female were more likely. This one indicates that male more likely to receive radiotherapy than females, and this is mainly because of the breast cancer. When we added the primary site because of breast cancer, and prostate cancer, males here became more likely to receive radiotherapy. Conclusion: radiotherapy utilization in New South Wales was low compared to optimal and other countries, and the study showed that the following factors predict low utilization: old age, female gender, and longer travel distance. What's next? We found that This is the same arrangement or location of New South Wales radiotherapy departments during the study period. Since that time, there were like 6 new departments running and in these areas. And what I did here, I recalculated the route distance, including these ones. And in this slide, we found that the accessibility to radiotherapy department increased markedly, at least by 7% for each travel distance. And it's planned to, for this study to be repeated to look at the impact of these new radiotherapy department on radiotherapy utilization. Thank you.